a team of good cardiologists, the cardiac surgeon myself, Dr. Pankaj, Dr. Non-intervention Dr. Noel needs to come, and cardiac surgical team from my side, Dr. Divya, Gauri, Perfect. So just to brief about what is the other thing we are doing in as a department as cardiology, which we have as I told you, the functioning cardiology are three. So the routine procedures like coronary angioplasty, bypass operations, and those things are going up. But what different we are doing in it, that's just what I want to highlight. Regarding cardiology department, we have Dr. Nikhil, who has performed the TAVI procedures first time in the Goa, which is a new advances in the valve replacement. We have Dr. Sabyasachi, he will come, who has performed the leadless pacemaker, which is the first time performed in Goa, which and Dr. Jyoti, she has performed the difficult aortic intervention, coronary angioplasty. And from I have Dr. Pankaj me, who will actually, this was my initial, I told you, this was the niche department regarding cardiology. We never focus. We are the only person in Konkan region who have PET with FDG, and he will speak more about that. Dr. Noel, he will be joining, so he will also speak about his non-interventions thing, what we are doing in diagnostic world. And coming back to my department, myself, Dr. Rakesh Dismani, consultant cardiovascular surgeon here in Goa, Manipal Hospital. In cardiology, so cardiac surgical type, we are operated more than 700 open heart surgeries till now with good rate. And out of that, we want to focus on, like, we did more than 500 off-pump coronary artery surgery. We call it like beating heart surgery, in which actually we don't put the patient on one machine. We call it as cardiopulmonary bypass with very good result, which actually avoids the patient ICU stay, blood transfusion, complication rates. So we have done more than 500 successful beating heart cases till now here in Manipal Hospital, Goa. With me, I want to introduce my team, which contains with me Dr. Divya Mahadar, which is sitting right here. She is the cardiac anesthetist, because when we do this surgery, the heart is beating, we don't stop the heart. Usually, routinely for the surgeries, we stop the heart and we do. But in this surgery, heart is beating, and on that way, we only do the surgery. And with very good. And regarding others, we have recently done like two high-risk cases we call as aortic dissection or aortic acid, which is called Vental procedure, with both the cases having the successful outcome first time at Manipal Hospital. And we have done the redo cases, like redo wall cases, which are very high-risk cases. So we are covering entire spectrum. And we will be planning to start a minimal invasive program or pediatric cardiac surgery program once our pediatric department will take over. So this was just a brief introduction from my side. So like I will give it to the individual person who will brief it on their field, starting with the madam.
Yeah, I think Dr. Noel and Dr. Sabyasachi has got stuck with cases there. They will join in soon. So, madam, yes, please.
We are very thankful to all of you all, for joining us today. The objective of this meet, as Sir and Sangleni, just to tell what new things are happening in cardiology, in cardiothoracic surgery, in our department and in Goa and in this country. म्हणजे खूप डेव्हलपमेंट झालेले आसा. See, today's patient, I mean, anyone who is diagnosed हार्टाचे प्रॉब्लेम आसा, there is nothing to fear. There are a lot of things we can do. म्हणजे curative options खूप आसा, treatment options खूप आसा. Every aspect of हार्टाचे treatment and इतले improvement झालेले आसा. And we are blessed to be associated with Manipal Hospital, where the latest technology is adopted very quickly, since Manipal has many branches, and we are able to get the latest equipment as soon as it is introduced in the country. Manipal Hospital is one of the first hospitals which adopts new technology which can help patients. And the other thing to tell the public, because it is फ्री ऑफ कॉस्ट दीनदयालाचे ट्रीटमेंट मणिपाल हॉस्पिटलान एंजिओप्लास्टी केल्यार बायपास केल्यार आनी खुबशे प्रोसिजर्स केल्यार इट इज ऑलमोस्ट फ्री ऑफ कॉस्ट टू द पेशंट. सो भिवपाचें ना की प्रायवेट हॉस्पिटल आसा थंय गेल्यार पयशे लायक पयशे वतले. इट इज ऑल कवर्ड अंडर गव्हर्मेंट स्किम्स. दीनदयाल इज लास्ट 2017च्यान 2017 दीनदयाल स्कीम येलेले आसा मणिपालान आनी ॲज ऑफ टुडे आमचे नंबर्स आर लायक आमचे कॅथलॅबाचे हार्टाचे प्रोसिजर्स इन द लास्ट 10 years आमी 12,000 प्रोसिजर्स केलेले आसा. 12,000 cases in the last 10 years cardiac procedures in Manipal hospital have been done and out of which almost 3,000 are हार्टाचे एंजिओप्लास्टीज म्हणजे हार्टाचे ब्लॉकेज असता आणि ते काढपाचे प्रोसिजर्स ऑलमोस्ट 3,000 एंजिओप्लास्टीज आणि फ्रॉम 2018 till now almost 800 free angioplasties have been done under DDSSY scheme in Manipal hospital. So that's what we want to emphasize ki samke latest technology use jata hanga and thanks to government support and government schemes it can be done free of cost. Everybody from Goa should know that ki heartache problem aslar treatment has advanced so much, so don't fear, come to the hospital, get a diagnosis, get your treatment. So that was this. I just want to show one case which is little unusual. So as a cardiologist, our main job for all of us, most of us sitting here, is mainly treating heart attack patient. Cardiology म्हणजे heart attack patient janka asta, chest pain asta, heartache blockage asta. 90% of the time we are trying to save those kind of patients. म्हणजे heartache भितर blockages ache patient. But even blocks can occur in other parts of the body also. Heartache is the main one which we all do, but it can occur in other parts of the body. So हे माझे एक unusual case आशिल्ले. एक lady आशिल्ले 56 years old आचे आमचे कडे फोंडा रावता ती 2 वर्सां पयलीं आमचे कडेन येयले म्हणजे 2022 सप्टेंबर दिस तशें. ओके, सो तिचे स्टोरी कितें आशिल्ले, तिचे डायबिटीज आसा. आतां खूब लोकांक डायबिटीज आसा, स्पेशली आमच्या गोव्यान इट इज वायड स्प्रेड. डायबिटीज इज वन ऑफ द मेन कॉजेस ऑफ ब्लॉक इन द ब्लड सर्क्युलेशन, वेदर हार्टाचे ब्लॉक आसूनी, पांयाचे आर्टरी ब्लॉक आसूनी, ब्रेनाचे स्ट्रोक जावपाचे, किडनीचे ब्लॉक जावन किडनी फेलियर जावपाचे, डायबिटीज इज द मेन कॉज. द डायबिटीज इज व्हेरी वायड स्प्रेड. हे लेडीक सुद्धा डायबिटीज आशिल्ले, लास्ट 10 years तिका डायबिटीज आशिल्ले आणि तिका कितें जालें की अबाउट 6 months बिफोर शी केम टू अस ताका दोन्ही पांय दुखताले आणि ते वाडत गेले. शी वॉज हॅव्हिंग प्रोग्रेसिव्ह पेन इन बोथ द लोअर लिम्स, म्हणजे दोन्ही पांय पोटाच्यान सकल खूप पेन आणि इट वॉज वर्सनिंग अँड वर्सनिंग, म्हणजे ताका पेन जावन मागीर चलपाकूय जायना. सो इनिशियली शी वॉज लिटल इनकॅपॅसिटेटेड, देन शी गॉट इवन वर्स अँड वर्स. मागीर ताका पांयाचे गँग्रीन म्हणून सुरू जालें. गँग्रीन म्हणजे पांयाचे सर्क्युलेशन कमी जावन द पार्ट स्टार्ट्स डायिंग. सो पांयाचे टोज आशिल्ले न्ही, फॉर 2 months बिफोर शी केम टू अस ते पांयाचे टोज सगळे लेफ्ट सायडीचे सगळे ब्लॅक कलर जावपाक सुरू जाले. ते टायमीन when she was investigated, she was admitted in Goa Medical College. Investigation diagnosed झाले की त्याचे the main artery which is going to the lower limbs, म्हणजे lower part of the body, main aortic pipeline असतात. You can see that red that picture I have just put. You can see one red line, no, that is the main pipeline going to both the lower legs. Can you see that pipeline? ते pipeline main artery ते aorta म्हणटा. Okay, so that supplies the entire lower heart of the.
No, it's functioning, but it's on.
सो ते हे aorta म्हणटा आणि हेचेर राईट लेगाचे एक वता आणि लेफ्ट लेगाचे एक वता. सो दीज आर द किडनीज. ओके, दिस इज द aorta. ते लेडीचे कितें आशिल्ले, दिस वी हॅव टेकन अ शूट आमचे दिस. सो यू कॅन सी हे पार्ट ऑलमोस्ट मिसिंग आसा, म्हणजे हांगाच्यान हांगा कनेक्शनूच ना. इट इज लायक वन थ्रेड, लायक एक थ्रेड पाशे फ्लो जाता. सो इट शूड बी अराउंड 3 to 4 centimeters. हांगा एक मिलिमीटराचे फ्लो जाता. शी हॅड अ ब्लॉक बेसिकली ओवर हियर, विच इज unusual. It is a rare case. ताका लागून हांवें प्रेझेंट केलें. आमकां एवरी डे आम्ही सगळे हार्टाचे ब्लॉकेज डेली इन अँड आउट आम्ही काढता, बट दिस इज अनयुज्युअल. थोडे लोकांक पायान हांगा ब्लॉक जाता पाय कट करचे पडटा, बट इन दिस टाइप ऑफ लोकेशन इट इज अ लिटल रेअर. सो दिस वॉज डायग्नोज दॅट शी हॅज very thin flow, when this whole part is almost missing, flow na. Okay, why this has happened? Because diabetes, degeneration down, lot of calcium had got deposited, and like rock hard calcium ashille, so there was hardly any flow through that. Okay, so this diagnosis was made even before she came to us. म्हणजे CT scan बी सगळे diagnose करून GMC she spent almost 15 days 20 days तेजे पायाचे ते dressing बी करून. Okay, but there also she was told, just go back to the previous one. Yeah, so she was in severe pain. Okay, agonizing pain which left untreated. Slowly कितें जाता की blood flow full cut जावन मागीर they will have to go for amputation. Amputation म्हणजे पाय सामके कातरचे पडटाले. So that is the most catastrophic, the most destructive thing that could happen. And the problem was that why this was a difficult case is because it was rock hard calcium. Means to open that through that is a very difficult process. So when we went through her, so then she came to us. Outside also she was told that a special method that is called as intravascular lithotripsy. एक नवे method येलेले आसा that came to us only in 2022. In the country also it started being used only in 2022. A specialized technique where the calcium is ruptured. All these years हे method it was being used for kidney stones. Lithotripsy म्हणजे kidney stone तोडपाचे ते that was the technique. Okay, but nowadays last 2-3 years only it has come in this country that it is being used even for blood vessel blockages. Calcium असता थंय break करपाक calcium. So then we decided to use this new technique called as intravascular lithotripsy, which is a specialized equipment to break open the rock hard calcium deposits in the aorta. And we did that. So this is done just like an angioplasty, but the balloon is different. It is a specialized balloon. So at that time it was not available anywhere else. So that's why she spent almost 1 month waiting in Goa Medical College. She was told that this is going to be the method, but I mean, in the government it's little difficult to get any new technique, any new method. So because in Manipal we were able to obtain that machine quickly, and this was critical. She couldn't wait for 3-4 months where in the government sector it could be done. So she came to us because if it was not done at that time, there was a very high risk that she was going to lose both her legs, and she was in severe pain, believe me. I mean, I remember so well when she was brought to my OPD. She was crying on the wheelchair like maka marpache, maka zaina, maka this is like just relieve me. I mean, like let me just die, because it is like the entire lower half of the body was not receiving blood circulation, almost cut zalele asa, just one tiny trickle of flow. So it is like day and night. She would not spend even 1 minute without pain. It is severe pain and is severe distress. It was very distressful to see her in that state. So then we brought this machine. We used this. This was the first time for the aorta. It is the first time in the country that this kind of technique was used by us. So go to the next slide. So we broke open. So you can see this whole thing was missing. So we broke open that calcium. It is done like an angioplasty only. पायाच्यान एक ते tube घालता आणि हातीच्यान एक tube घालता. So no cutting, no open surgery, no incision is taken. So we opened the artery and this was how. So this whole part was missing. So आम्ही मागीर stent घातलेले आसा. Now you can see the whole thing is flowing. So this brought absolutely instant relief. म्हणजे आम्ही at the end of the procedure her pain was gone. आणि त्याचे अल्सर बी आशिल्ले ते सगळे हील झाले 1 महिन्यान. राकेश सर will tell, he was handling the ulcer. So it healed within a few days. आणि आता she comes walking to our OPD. Okay, she comes happily walking. It's been 2 years. We presented after 2 years because amka long term follow up सुद्धा पोपाचे आशिल्ले. So she's absolutely symptom free. She's and just before this procedure also, just before this was done, we also found that she had त्याचे हार्टाचेच भितर सुद्धा तिन्ही आर्टरी ब्लॉक आशिल्ले. So we did that angioplasty before we did this. Just the 2 days before that aorta was opened up, त्याचे हार्टाचे angioplasty सुद्धा आम्ही केलेले. And by God's means all this was covered, most of it was covered under DDSSY. It is just that any new equipment, it is much easier for, because Manipal being such a, always, in favor of advanced techniques and, they help us a lot when anything new comes, it is, we are one of the first people to get it, to adopt any new technique. So we were able to save her life, she is very grateful and, she walks in with a smile to our OPD now. So, and this was the first time that this type of aortic balloon was used in the country also, because see, this balloon is much different from the heart balloon, because this is the main artery, त्याचे सेंटीमीटर 2-3 सेंटीमीटराचे असता, हार्टाचे आर्टरी म्हणजे 2-3 मिलीमीटराचे असता. So those were still there in 2021-22 they came in the country, but this type of lithotripsy means using that to break open the calcium was for the first time that we did it over here, and it was, by God's grace everything went well. And also I should say that they were from a poor family, so majority of it got covered under DDSSY. So they were also, grateful for everything, and we are also grateful that we were able to do, achieve this result for her. Diabetes, diabetes is the main cause, but this is a rare location. It is not common to have to have that entire lower half of the body almost cut off. So it is rare. That is the reason why we present it. म्हणजे हार्टाचे blocks खूप असता. This blocks are there, but that rock hard calcium opening with lithotripsy, we did it for the first time, sir. Long term means she's fine. It's instant relief. See, there's no cutting involved. They केले next day तेका discharge झाले, and it was dramatic. म्हणजे open cath labaचे table आणि ते balloon use करून expand केले, stent केले, the pain is gone. Within 5 minutes the pain is gone. Whatever last 6 months they wheelchair bound and crying, all the means you can imagine the pain of block is very severe. So janka lower limb bhi block asta आणि blood circulation कमी असता. That pain is the most distressful pain. Even during our MBBS days and all, we are always told that pain of a blocked artery to the leg and all, they are the most miserable patients.
All treatment all Manipal hospital.
Yeah, she was in GMC for almost a month, 15 days to a month. Thanks सुद्धा सांगले तुमका we have to use this thing called as IVL, but आमच्याकडे ना म्हणजे that this is a new method. म्हणजे ते टाइमान GMC नशिल्ले. This was in September 2022, 22nd September 2022 आम्ही केले. But at that time, so almost 1.5 months. So she came to here as like last option. की आम्ही सगळेकडे केलेले असा, it's I'm just not getting better and some new method which as the moment I cannot use that way. So we got it and we did it for her.
This treatment of cost.
That's what, see, the balloon cost is actually around 3 lakhs, but amche Deen Dayalache, because it's a new thing, but Deen Dayalache, most of it gets covered. Okay, so that's Deen Dayalache. Yeah, but these are not recurrences, sir. A life on 840 karpache procedures, sir.
In there you can fill in multiple times. Every different procedures are there. Till your that limit is there.
Yeah, this is an unusual case, and this is not used for all patients, not required for all patients.
She comes out again and she requires another stent.
Yeah, but Ata almost. Yeah. Anyway, this is the 3rd year. She's good.
लिमिट ऑन रावपाची आणि तुमची प्रोसिजर
Yeah, my other senior colleagues also have a lot of other interesting things to present. I'll hand over the food.
Good afternoon, everyone. After a very wonderful demonstration with my senior colleague, Dr. Jyoti, I'm going to talk about valve replacement. You must be knowing that traditionally valve, that is आपल्या हार्टचे 4 valve आता. So any problem with the heart valve is the domain of the cardiac surgeon. So valve replacement till 2019 in India, I'm saying, was any problem with the valve was to be referred to a cardiac surgeon. Open heart surgery is required to be done for such patient. But nowadays, with innovative methods and advancement in manufacturing of the valve. Now we can even replace all the heart valve, the 4 watt heart valve by a transcatheter method, like how we do an angioplasty inside the cath lab. That's why how we can do the replacement of the heart also inside the cath lab. Need not be all patients with heart valve problems be subjected to open heart surgery. So I have done 2 cases in Manipal Hospital where we had replaced the diseased valve by a transcatheter. So, as I told you, surgical aortic valve replacement or open heart surgery are the main, and transcatheter. These are the 2 methods to how you replace the valve. But open heart surgery has some risk factors. It is usually not recommended for senior patients or who have very old patients who have diabetes, hypertension, renal dysfunction or kidney disease or any lung infection, or they are extremely obese, or they have any history of previous cardiac issues or any history of paralysis. So usually heart patients who are very high risk for open heart surgery. But you cannot just leave the valve, blocked valve like that. We have to replace the valve. If we are not going to do a open heart surgery, we have to do something, a non-surgical way, which is now available nowadays to replace the valve. So what is known as a tower is trans-aortic. We go through the groin, through the into the artery, and then go within and into the heart, and then we replace valve. So trans-aortic valve replacement has been observed to be effective in managing long-term symptoms of aortic stenosis. Is a blockage of the valve. Any stenosis means valve block. Any leak is known as regurgitation. Next slide. So it is a minimally, what is the tower? Transcatheter aortic valve replacement. That is through a transcatheter, we do it in the cath lab under local anesthesia or mild sedation. Patient doesn't require general anesthesia. Okay. So it is a minimal invasive treatment for severe blocked aortic stenosis in senior or elderly patient with multiple comorbidities, and it is proven effective in improving longevity and restoring normality of life. Next slide. So that's what I mentioned. It can be done without general anesthesia and does not require stopping of the heart. The most important drawback of an open heart surgery is that heart-lung, we have to stop the heart, transfer the function of the heart to a heart-lung machine, replace the valve or do whatever bypass surgery and then close it. So there's a lot of time involved, a lot of risk involved. There will be risk of death also, especially in very elderly patients. So it is a minimal invasive catheter-based technique during which the doctor replaces the patient disease valve with a bioprosthetic valve. What is a bioprosthetic valve? It is a valve made from either a tissue valve, either from a cattle or a ox or a pig. It is also known as a porcine or a bovine. The life of those valves is almost 15-20 years. Okay, so that's how it is. So once in place, the valve immediately begins functioning. You will be discharged from the hospital within few days, maybe either not the second day but the third day. You imagine an open heart surgery patient can lie down almost for a week or 10 days, depending if there is no complications after the procedure. So this novel intervention technique is somewhat similar to angioplasty, what I have done, and it can be done, and it is done in the cardiac catheterization or coronary angiography laboratory. Next. So this is the catheter, it's a device through which this is the valve, and the valve is placed from the groin, like how we do an angiography. It is mounted on the balloon and catheter, and this is the unopened valve. Next slide. So the balloon inflates, and you can see this is the artificial valve. So the valve is mounted inside a disease valve. So when it opens, that block valve, the native valve immediately opens, and the function is taken over by the new valve. So this is how a fully deployed valve. So valve remains in the body. The catheter is taken out, and then this particular valve takes over the function of the heart valve. So there are 4 valves in our heart. All the valves can be now replaced with transcatheter if patient has any contraindication for open heart surgery. So what are the benefits of transcatheter? It's the latest technology, very faster recovery. Patient can be discharged on the 3rd day. It's the non-surgical, very, very important. Better quality of life, because the complications of a open heart surgery, which if happen like a stroke or a kidney problem or lung problem or related to general anesthesia, they are usually not seen in this transcatheter. There is a shorter hospital stay, of course, only 3 days. heart function is as good as if compared to like a surgery. The function of the heart function is preserved. There are no scars. Most importantly, it's a sutureless thing, and lesser pain and anxiety. So this just show the demonstration of the video. What we did with this. Just one. So I just want to highlight about this case. What we did. This was the first valve in valve. What is this? It was a 70-year-old lady. She had come from Vengurla, which is nearby in Sindhudurg. She already had undergone a surgical aortic valve replacement in 2011 in Medanta Hospital in Gurgaon. 2011. Last year, another valve of her was surgically replaced by Dr. Rakesh. Already 2 surgeries over. When she underwent the first surgery in 2011, her age was 52 years. Last year, she was around 69. This year, the valve which was replaced in 2011 became diseased. She was not taking care of her, she developed diabetes, and that valve also started leaking. So, already 2 surgeries over, age is more, she has become frail because of diabetes. Till fortunately, her coronary arteries or the heart arteries were okay. So, the only option left was she had completely refused the 3rd redo surgery. Already underwent 2 major heart surgeries with a heart lung machine and all that. So we offered her the option of a 3rd procedure, but through a transcatheter. So what we did, we put a new valve inside that old disease valve, and so that is the best option now, that you can go do a transcatheter in n number of times, because the duration, the life of that transcatheter valve is almost around 10 years. So most important advantage, patient may not require a redo surgery later on. So all these 4 valves, we can do this transcatheter. This was the video. So this is done inside the cath lab. This is our whole team. This is the valve. We have to mount the valve on the table. This person is loading the valve. So this is the cath lab screen. So you can see the valve in his hand. This is the valve. This is the valve. So it will be loaded onto this catheter, yellow catheter. This is the catheter. And this will be inserted to the groin. You can see this. This is the disease valve, and this is the new valve inside. This was the old valve which was leaking. That's how we do this. So now the function is taken over by this new valve. So this was the first time we did this valve in valve procedure in the entire Konkan region. It is still not done in Konkan, valve in valve. And we have done a second case of a native valve of a young patient of 57-year-old who had refused surgery in Goa Medical College. And because the patient was young and he was not, the patient was also not fit that time for transcatheter valve therapy. So he came to us, and with our able heart team. So this, very important is this particular procedure should be done in an institute where there is a backup for heart surgery also. Because some problem if happens during the transcatheter, only option left is the heart surgery, the surgery. So it is this is usually a heart team is there, who are all involved in the heart team, the cardiologist, the cardiac anesthetist who will be supporting during the procedure. The surgeon should be backup, the non-invasive who does all the tests like echo and all that. So it's an important thing. So it's a heart team approach. It's not only a patient himself cannot decide, himself or herself cannot decide on this therapy. It's a discussion being done in the heart team. So when we find that this patient is very high risk for surgery, then we give the option of a transcatheter approach for this patient. And then we do it. Thank you.
ECG, I think maybe most of you all must have had an ECG by now. So we have ECG, then the other tests involved are echo, then we have stress test, then we have Holter, and we have 24-hour ambulatory BP monitoring as well. All these tests are available here, and we most of you all will be knowing that we need to go through probably ECG, echo, and treadmill to get a diagnosis, probably if you have a block or something, unless you already have a heart attack. So these tests have to be done before we come to know that we require an angiography or anything, before any of my colleagues take over. So, so all these tests are done here, and some of the other tests, which special tests which we are doing over here, is like transesophageal echocardiography. In this test is done when we cannot see the heart. Say when we do an echo, we take the probe on and we keep it on the chest of the patient and we look at the heart inside. But sometimes in certain cases we cannot see all the structures of the heart properly. Whether maybe the patient is obese or certain structures are not visualized as well. So we need another way of looking at it. So in that case, most of you all must be knowing about an endoscopy. Okay, so like that we have a probe which is put through the mouth. Okay, it goes into the foot pipe of the patient, and from there it is closer to the heart. So and we get better images of the heart. So we, if you know, echo is like an ultrasound. So this is an ultrasound, but more closer to the heart, and we get better images, and those images then we can diagnose what is the problem. Okay, so this is called as transesophageal echocardiography. Okay, this is another advanced test which is available here. Then another test that we do here is a dobutamine stress echo. Now this is, many a times we have patients who say that they have chest pain, but they have, let us say, a leg problem. They cannot walk. So we have done ECG, we have done echo, we have done probably cardiac enzymes. All these tests are normal. Okay, so do we say that there is no problem? We cannot say that. We either have to go for an invasive test like an angiography, or we have to do some other test to rule out that there is a block or not. So when we cannot use the stress test, we can also do another test called as dobutamine stress echo, in which we use an injection which we increase and which increases the heart rate of the patient. So when we increase the heart rate of the patient, it mimics like as if the patient is walking on the treadmill. And then we monitor the ECG and we monitor the echo also, and that will allow us to know whether the patient has a possibility of having blockage. If there is a possibility, then again it goes to the invasive for a angiogram. Okay, there are some other tests also which we can do when if the patient doesn't want to do dobutamine or anything and doesn't want to do angiography. That I think Pankaj will be talking about. Yeah. So I'll hand over the mic to Pankaj.
Good afternoon all. So just like our cardiac team consisting of a team of cardiologists and cardiothoracic surgeons, just like Dr. Noel, I am a nuclear medicine physician. So our role is basically to help in diagnosing and providing the team the information that is relevant to the management of a heart disease. So we have a functioning nuclear medicine and the PET-CT department in Goa. This is the only department in the state of Goa that we have, and even if you consider South Maharashtra and North Karnataka. So basically what we do in nuclear medicine is diagnostic studies in which we can provide information which is of physiological significance. So just like all of you, I'm sure, must have heard of treadmill test that Dr. Noel does. So exactly like treadmill test, we make a patient physically exercise on a treadmill or a bicycle ergometer, center, and we inject a radio tracer. So in addition to the ECG monitoring that is done as a part of a treadmill test, what we do is we inject a radio tracer that goes to a patient's heart, and it gets localized in the heart muscle of a patient. And then we image the heart of the patient to know which area of the heart muscle is not getting proper supply when the patient is exercised. And then same study is repeated at rest to see is there any improvement over the exercise images. So what basically this imaging tells us is there any physiologically significant blockage that may be there, which has to be ultimately treated by a team of cardiologists. So this test is basically called as a gatekeeper test to invasive procedures, where we can evaluate intermediate risk patients and the patients who may have an equivocal treadmill test to exactly tell them if they require further evaluation or not. So it is more of kind of a screening test. Of course, it is not used as a common test like ECG when we do it as a part of health check or something. There are very specific indications where this test is used, and this is available with us. And the next study that we most commonly do is a PET cardiac viability evaluation. Now, where this study comes into picture is when we have a patient who has a multiple blockages in their heart vessels, and they have a poor the poor pumping capacity of the heart. These patients mostly get benefited with the the coronary artery bypass grafting, that is CABG as it is commonly known as. However, before going for such an invasive procedure, we need to know if this patient is going to benefit after going through such an invasive procedure. So to know that, what we need to know is basically is the heart muscle viable, that is living or not. If the heart muscle is living, only then restoring the blood supply to that part of the heart muscle is going to help the patient to have a better contractility or a ejection fraction. The gold standard evaluation for viability of the heart is a PET. So we do a PET scan in which we again inject a radio tracer to a patient and take images of the heart to know if specific part of the heart is viable or not. Now, only the cases where the heart muscle is viable, those patients will be subjected to a bypass grafting, and they will definitely get a improvement in their ejection fraction after doing a bypass surgery. Whereas those patients who don't have viable myocardium, their myocardial wall is, the muscle is not functional, those patients don't get benefited. So those patients are better treated with a medical line of management. So that is where we come into picture, and these are the tests only available, which are available at our hospital in entire Goa. And PET we have started just this year in February, and we have been actively getting patients for the evaluations of myocardial viability. So that is what we have. We wanted to sensitize you that all these evaluations, advanced evaluations, are available with us and can be used for the better management and outcome of the cardiac patients. Thank you so much.
Thank you so much, sir. This was a quick overview of our cardiology department. Dr. Sabyasachi couldn't join because I think that's one life that unfortunately they do miss. There are cases that happen suddenly, and
You can show sir
Yeah,
slide
okay.
because all the latest advances in cardiology. First one.
yeah. Yeah, so maybe one of you all could just.
Yeah, so. My senior colleague, Dr. Mukhopadhyay, is doing a case. So what we want to, that these are the new procedures which are just been in the country for the last few years only, and which are being carried out by our department. So there's something called as cardiac resynchronization therapy. The first time it was done in Goa here. So this is a method in which heartaचे pumping jenna kami zatani. So there's a special pacemaker which is put in the heart, which is going to improve the pumping, because it's very difficult to treat a patient with low pumping capacity. So this is one method which helps. It's a specialized type of pacemaker. The other thing is this intravascular lithotripsy, which I have spoken about, दॅट इज जस्ट लाईक किडनीचे स्टोन काडटा न्ही तशें ते लिथोट्रिप्सी मेथड आमी हार्टाचे भितर आनी सगळे ब्लॉकेजेस काडपाक ते कॅल्शियम काडपाक ते यूज करता. देन दिस अदर मेथड of a pacemaker, the first time it was done in our hospital in Goa. It is a leadless capsule pacemaker. Then left bundle pacing is also done here. These are all specialized pacemaker methods which are which restore म्हणजे ते हार्टाचे रिदम ऑलमोस्ट लाईक नॉर्मल नॅचरल गॉड गिवन हार्टाचे असतात तसे रिस्टोर करता द लेटेस्ट मेथड्स ऑफ पेसिंग. देन वी हॅव डन डिवाइस क्लोजर ऑफ ASD. ASD म्हणजे हार्टाचे भितर होल जांकां असता आमी विथआउट सर्जरी आमी क्लोज करता युजींग अ डिवाइस अँड टू चेक the blocks in the heart. There are newer methods. It is like हार्टाचे भितर आमी कॅमेरा घालून पळयता. So that is optical coherence tomography, IVUS. These are all new methods which are being used. आणि आमचे results खूप improve जाता जेन्ना आमी हे methods use करता. Then outcomes, patient outcome खूप बरे जाता. Then we have used absorbable stents. म्हणजे सी नॉर्मल आता स्टेंट्स आसा आनी ते मातशे मेटल असता तेंचे, ऑल्दो दे आर व्हेरी व्हेरी थिन, इट इज स्टील मेटल. आता न्यूएस्ट मेथड इज दॅट अब्झॉर्बेबल स्टेंट्स म्हणजे ते स्टेंट आम्ही घालता ते इट गेट्स अब्झॉर्ब्ड इन टू द बॉडी, सो देर इज नथिंग रिमेनिंग. इट इज लाईक अ नॅचरल नॉर्मल आर्टरी. आम्ही ते वायडन जाता आणि मागीर ते वायडन स्टेटान इट रिमेन्स लाईक दॅट अँड वॉट एवर स्टेंट इज पुट इज अब्झॉर्ब्ड. सो दोज आर ऑल द लेटेस्ट methods आणि hopefully after a few years more and more advances जातले हे methods and we'll have better and better things. And we use a lot of the most advanced latest stents are always available. Whatever is there in the best in the world is always available to us in Manipal Hospital. So again the message is that there's lots and lots of advancement which has occurred in this field of हार्टाचे ट्रीटमेंटाचे. आणि in spite of all this, see आमचे डेली आम्ही न्यूजपेपर काडटा, वी हियर दॅट सो अँड सो ते नाचताले आणि ही फेल डावन अँड ही डायड. समबडी एल्स बसीन ही वॉज बसीन बशिल्ले आणि ही डायड. आणि कोण दिस जिमान आशिल्ले सडन हार्ट अटॅक जाले, ही एक्सपायर्ड. सो in spite of all this we feel very sorry when we read this, because heart disease treatment खूप advanced methods असता आता. So the problem is not diagnosing in time. म्हणजे पेशंट सारखे टाइम ऑन अर्ली स्टेज इन डॉक्टराकडे पावल्यार देर आर लॉट्स ऑफ थिंग्स टू सेव्ह पेशंट्स लाईफ अँड टू प्रिव्हेंट डेथ्स. आणि एज आय टोल्ड यू अगेन आमचे गोवन गव्हर्मेंट दीनदयाल सपोर्ट आसा, आमचे हॉस्पिटलाचे सगळे न्यूएस्ट लेटेस्ट मेथड सगळे यूज जाता ते दीनदयालाचे. सो वी वॉन्ट मोर अँड मोर पीपल टू टेक एडवांटेज ऑफ दॅट. वी वॉन्ट टू सेव्ह मोर अँड मोर लाईव्स. दॅट इज द थिंग. ओके. Yeah.
Ask you, you have seen a lot of cases they get heart attack or something kind of. What is the method you have for that kind of patient to get sudden heart attack, or if it's a hole in the heart?
Yeah, now, hole in the heart is a different thing, sir. Hole in the heart म्हणजे ते जन्माच्या नसा, म्हणजे from birth it is something which is there. But yeah, हार्टाचे blockage is what causes heart attack. So heart attack जेन्ना जाता, the early symptoms are usually breathlessness आणि हार्टाचे सेंटराचे कितें constricting feeling. Any patient who tells की म्हाका कितें constriction तशें जाता, it looks like as if somebody is holding me, holding me tightly, it is usually heart pain. तर तसले कितें symptom असल्यार we will advise everybody to immediately seek medical help. Okay, go to the nearest hospital. See if this happens in the periphery, nearest hospital pasun casualty. And see when there is chest pain, don't go and sit in your general practitioner's office, because thai ek lam line asta. See, heart attack is always emergency. Samki emergency asta jenna heart attack asa. So jitle begin treatment, jitle begin diagnosis ata, title outcomes title bare urta. Okay, so when there is any patient, like we want you to spread this message to everybody ki the slightest ki the doubt aslar ki attack asa, first thing is नियरेस्ट हॉस्पिटलाची कॅज्युअलिटी इमर्जन्सी डिपार्टमेंटान पावपाचे थंय एक ECG काडूंक जाय. ECGन आमकां फर्स्ट, दॅट इज द फर्स्ट लायन. म्हणजे ECGन अटॅक दिसल्यार Again in Goa we have a very good system. आमचे गव्हर्मेंटाचे सिस्टम आसा ते STEMI प्रोग्राम म्हणून. Even the remotest health center and ECG आता technology आसा आणि ते ECG even if it is taken in some remote area of Sakli or some Toe or some Bali health center थंय आमकां ते मेळटले. आमकां ते this thing, I mean the ECG is sent to a central place where the diagnosis जाता, okay, this is heart attack patient. तर immediately तांकां injection दिव. The first line there, even in Goa, is injection दिता. म्हणजे खूप, if the person is very far away, the clot busting injection. Okay, that is the first line. Okay, if heart attack diagnosed जाल्यार clot busting injection दिवन patientak मातशें stabilize करून next step is to transfer him to the nearest big hospital. Either it will be Manipal. We are also empaneled. आमचे गव्हर्मेंटाचे STEMI program म्हणून आसा heart attack patient. Okay, so we are also empaneled. So from the health center they are sent either here or lot of them will go to GMC. And third next step will be an angiography and to remove that narrowing which has caused the heart attack. So the main thing is to diagnose on time. म्हणजे सारखे problem is खूप patients लागता की indigestion आसा, acidity आसा, म्हाका like काल कितें हांवें extra खालें, थंय party गेलें, ताका लागून indigestion आसा. But many times indigestion pain can be heart attack pain. तांकां misdiagnosed, means the patient feels it is indigestion. ताका लागून we hear somebody on the stage, he was singing, ताका 7 दीस तो he was taking acidity tablets and then he has died on the stage, a very very famous singer. ते daily जाता, it's happening all the time because patient they are not able to realize that symptoms ते असा acidity चे ना, indigestion चे ना ते symptoms, muscle pain चे ना, it is a heart attack. So you have to go to the nearest place where ECG is taken. Don't delay when there is symptoms. If the diagnosis is on time, then treatment samke bare jata. Late diagnosis zalyar always outcomes are bad.
What is the main cause of that?
Yeah, see, main causes are in this country, diabetes is the primary cause, then smoking. Okay, these are the two primary. If you remove diabetes, if you remove smoking from the community, आमचे countryचे हार्टाचे deaths will drop by 50%. आमकां सगळे we will be without jobs if this thing. If diabetes is removed from the country, if smoking is removed from this country, that is a primary. And next after that come high cholesterol level, high blood pressure. Okay, then dietary, junk food and many other factors. They are all in the order of importance. Okay.
समजा suddenly attack आयलो. तर ताका कितें घराकडे उपचार बी असले?
No, that's another thing which we would like to remove. Means तुमचे WhatsAppचेर, तुमचे YouTubeचेर 100 videos असता की हार्ट अटॅक जालो. Yeah.
अटॅक येवच्या पयलीं ते सिम्पटम्स दिसता.
Yes.
ते कितलो टाइम आसता?
No, that's what it is, very variable, sir. थोडे पेशंटाक फर्स्ट सिम्पटम्स जावचे नंतर नेक्स्ट थिंग इज अ कार्डियक अरेस्ट. ओके, आणि थोडे पेशंट्साक अशें लायक इंडायजेशन ॲसिडिटी जावन म्हणजे तशें तांकां दिसता. एक्चुअली इट इज नॉट इंडायजेशन ॲसिडिटी, इट्स एक्चुअली हार्टाचे इनिशियल पेन, एंजायनल पेन म्हणटा न्ही. इनिशियली इट लुक्स लायक इंडायजेशन टू द पेशंट. सो तशें कितें जाल्यार फर्स्ट इज गेट अ डायग्नोसिस. Okay, I mean go to the doctor, get an ECG done, ask your doctor ki actually the problem asa ki na. At home we really don't advise. To me, how many ever WhatsApp messages are there and how many ever videos are there ki hey kar they kar. Truly I don't think any of my colleagues will agree that any method done at home can prevent anything going wrong in a heart attack patient. Some patients are lucky, म्हणजे attack जाऊन सुद्धा they survive the attack, and they survive with little damage. But that is not the correct thing is nearest hospital, absolutely the nearest hospital पासून एक ECG card. Okay, and don't wait for तुमचे villageचे general practitioner might be very popular, there will be 100 patients waiting for him. Don't go and stand there as the 101st patient. To me, just go to the casualty emergency department of the nearest hospital, एक ECG card. And now because of so much of technology, even if the nurse takes the ECG, she will send it to the cardiologist with one WhatsApp message. The cardiologist has already seen, yes, attack asa, attack na. So it's very very important to take an ECG at the earliest. Okay, the diagnosis, if it is not done on time, the outcome is like it gets deterioration occurs very very fast. And when the heart stops beating and all, खूप difficult asa ते तसले पेशंटाक revive करपाक, it's very difficult. Early stage in पावल्यार the statistics as of 2024 in the world, is that if you come to a hospital with a heart attack, with a major hospital like this, okay, 99% chance asa if you come on time that you will go home on your feet. Only 1% of people who reach the hospital on time will die. This is not Amche statistics, no, I'm talking about the entire world in 2024. Okay, but still, in spite of that, we hear of people dying on the road and dying because the time and pavana, the time and power outcomes are very good, sir. We are, I mean, so much has, God has blessed the, cardiologists with so much of technology, and, we have so many things to do to save our patients. Okay.
Last question I would ask.
Yes, sir.
When you explain about the blood flowing
Huh.
in the blockage,
Huh.
if the person has a blood clot, in
Huh.
the leg, so what is next?
No, blood clot again has to be treated. So again, it has to be first diagnosed. The clot busting injection is the first thing. Okay, then we do angiography to see. Then we check the blood to see cholesterol high asa, ani kide problem asa, and we give blood thinners. Medicines are given for the blood clots. In medicines also, I mean, we have so many new medicines which have come. I mean, we can't include everything in our slides, but in the whole world, means technology, pharmaceutical industry also इतले advance झालेले असा की last 5 वर्षांनी there are newer blood clot, preventing medicines. We call it as novel anticoagulant drugs, rivaroxaban and all that. Means they are extremely, effective in preventing clots. Okay, आणि त्यांचे side effect खूप कमी असतात. Okay, but all this is not, patient cannot decide. म्हणजे तुम्ही डॉक्टराकडे बसून डिस्कस करून मागीर स्टार्ट करपाचे. आता 2024 चे वॉट एव्हर अवेलेबल ब्लड थिनर्स सगळे खूप इफेक्टिव्ह असतात आणि खूप कमी साईड इफेक्ट असतात. सो बी इन टच विथ युअर डॉक्टर आणि गेट हेल्थ चेकअप्स डन, कोलेस्ट्रॉल टेस्ट करीत रावपाचे, डायबिटीज आसा की ना म्हणून पळोवपाचे. whoever smoking has to stop smoking, junk food सगळे that has to be avoided. Okay, exercise चड करपाचे, हे सगळे केल्यार प्रिव्हेंट करपाचे. बट हे सगळे जाऊन सुद्धा जाल्यार वी आर देअर टू हेल्प आउट. ओके, अँड मोस्ट ऑफ द टाइम वी आर एबल टू सेव्ह द पेशंट इफ दे आर कमिंग ऑन टाइम.
राकेश सर, जेव्हा आपण वर्ल्ड हार्ट डे बद्दल बोलतोय, तेव्हा आपल्या देशात, राज्यात म्हणा, बहुतेक शिफ्ट वाईज काम करणारे खूप सगळे लोक आहेत. पण जेव्हा हार्ट डिसीज बद्दल बोललं जाते, नाईट शिफ्टमुळे सुद्धा त्याच्यामध्ये रिस्क आहे असं म्हणता येईल का?
म्हणजे तुमचा पण प्रश्न आहे की कुठलीही स्ट्रेसफुल, म्हणजे नाईट शिफ्ट, म्हणजे जेव्हा सगळ्या जगात झोपायची वेळ असते तेव्हा तुम्ही जो माणूस जागा असतो इट इज अ स्ट्रेस. ठीक आहे, म्हणजे कुठलाही स्ट्रेस कुठल्याही प्रकारचा दॅट इज नॉट अ गुड फॉर हार्ट. बट कुठल्याही माणसाला दिवस म्हणजे रात्री झोपायला एक 6 ते 7 तास झोप ही आवश्यक आहे. हे नॉट म्हणजे फक्त हार्ट डिसीजसाठी म्हणत नाही, पण कुठल्याही बाकीच्या डिसीजेस रिगार्डिंग तुमचे स्ट्रोक असतील, हे असतील जे रिलेटेड, म्हणजे आम्ही त्याला कार्डिओव्हास्क्युलर डिसीज म्हणतो, सगळ्यांसाठी ते इम्पॉर्टंट आहे. बट ऑब्व्हियसली त्यांची फिजिओलॉजी जर तुमची चेंज झाली तर त्यांना हायर रिस्क आहेच. हे नाही,
राकेश सरांनी जे सांगितलंय की फिजिकल इनॅक्टिव्हिटी ही सर्वात महत्त्वाचं कारण आहे. आता काही एक्झरसाइज, बरेचसे हार्ट अटॅक आता बँक मॅनेजर, वर्क फ्रॉम होम त्यांच्यामुळे होतात. काही एक्झरसाइज नसतो कारण, आणि टार्गेट ओरिएंटेड राईज झाले त्यांनी, एवढं टार्गेट तुम्हाला झालंच पाहिजे. तो रेस्ट मिळत नाही, बॉडीला रेस्ट मिळत नाही, झोप मिळत नाही. जसं राकेश सरांनी सांगितलं की 6 ते 8 तास तरी झोप पाहिजे आपल्याला. तेवढं नाही मिळालं तर रिस्क असणारच हार्ट अटॅक. कारण जास्तीत जास्त हार्ट अटॅक हे मध्यरात्री ते सकाळपर्यंत होतात, 12 AM to 6 AM इन द मिडनाईट. त्यामुळे त्यावेळी समजा तुम्ही कन्सिक्युटिव्हली स्ट्रेसफुल असतात, स्ट्रेस असतो. इव्हन वी ॲज डॉक्टर्स आम्हाला पण स्ट्रेस असतो जेव्हा इमर्जन्सी आम्ही अँजिओप्लास्टी करत असतो, पण देन वी टेक रेस्ट फॉर द नेक्स्ट डे वॉट एव्हर इट इज. तर आजकालच्या जगामध्ये फिजिकल इनॅक्टिव्हिटी, जसं मॅडमने आधी सांगितलं, स्मोकिंग, स्ट्रेस, प्रत्येकजण स्ट्रेसमध्ये, कारण प्रत्येकजण कुठल्या तरी टार्गेटच्या मागे धावतोय. सो दिस टार्गेट ओरिएंटेड थिंग शुड बी ब्रेकन डाऊन. त्याच्याने निम्मे हार्ट अटॅक कमी होतील. आणि जसं मॅडमने सांगितलं की टाइमली डॉक्टरांकडे दाखवा. प्लीज आता सुपर स्पेशालिस्ट सगळ्या हॉस्पिटलमध्ये अवेलेबल असतात. जनरल प्रॅक्टिशनर, नथिंग टू टेक अवे फ्रॉम द जनरल प्रॅक्टिशनर, बिकॉज दे आर द मोस्ट फर्स्ट पॉईंट ऑफ कॉन्टॅक्ट फॉर द पेशंट. पण जेव्हा हार्टाचा मामला आहे तो सुपर स्पेशालिस्ट आता सगळीकडे पदोपदी अवेलेबल असतात. तर त्यांच्याकडे जाऊन प्लीज आपल्याला इव्हॅल्युएट करून घ्या. यंग एज, एनी प्रिव्हियसली ते म्हणायचे की 40-45 वर्षानंतर हार्टचं इव्हॅल्युएशन होतं. आता वयाच्या 18व्या वर्षीपासून हार्टचं इव्हॅल्युएशन करायला पाहिजे. आणि हार्ट जर नाही, डायबिटीज, कोलेस्ट्रॉल, किडनी फंक्शन, कारण सगळे हे इंटर रिलेटेड असतात. ठीक आहे, त्यामुळे हे वर्ल्ड हार्ट डे कशासाठी सेलिब्रेट केला जातो, 2000 पासून तो सेलिब्रेट करायला जातो, कारण टू क्रिएट अवेअरनेस फॉर द हार्ट हेल्थी लाईफस्टाईल अमॉंग ऑल द इंडिव्हिज्युअल्स ऑल ओव्हर द वर्ल्ड. बिकॉज मॅक्सिमम जगामध्ये millions and millions of people are dying because of heart attack. So prevention is the first. But झालाच हार्ट अटॅकचं ट्रीटमेंट असते त्याला, आणि टाइमली अप्रोच टू द सुपर स्पेशालिटी ऑफ द कन्सर्न ट्रीटिंग फिजिशियन इज व्हेरी व्हेरी इम्पॉर्टंट. सो वर्ल्ड हार्ट डेचं इज द मोस्ट इम्पॉर्टंट मेसेज इज टेक केअर ऑफ युअर हार्ट अँड ऑन टाइम अँड फ्रॉम अ यंग एज.
महिलांना जास्त पुरुषांना जास्त?
आता महिलांना पण आता कसं आहे की महिलांना पण तेवढा स्ट्रेस असतो. आता नावडे त्या पण इंडिपेंडंट झालेल्या आहेत, त्यांना काय त्यांना पण वर्क स्ट्रेस असतो, प्लस घरचं पण मॅनेज करावं लागतं. त्यामुळे दे आर इक्वली ऑर रादर ॲट मोर ॲट रिस्क फॉर हार्ट प्रॉब्लेम, एस्पेशली आफ्टर द एज ऑफ 45 or 50. महत्त्वाचं म्हणजे इंडियन पेशंटमध्ये हृदयाचं प्रमाण कमी वयामध्ये सुरू होतं ॲज कम्पेअर्ड टू द वेस्टर्न पीपल, ॲज कम्पेअर्ड टू द अमेरिका, जिथे लॉंगिव्हिटी जास्ती असते, तिथे हार्ट अटॅकचे प्रमाण वयाच्या 60 वर्षानंतर 70 वर्षानंतर, कारण त्यांची क्वालिटी ऑफ लाईफ इज बेटर, द फूड व्हॉट दे ईट इज मच बेटर. तो का आम्ही म्हणतो की मेडिटेरेनियन टाईप ऑफ डाएट, म्हणजे इटली, इस्रायल, ग्रीस, त्या मेडिटेरियन सीच्या भोवती जे राहणारे कंट्रीज आहेत, लोक आहेत, त्यांचं डाएट इज व्हेरी फ्रेश, म्हणजे काही फ्राईड खायचं नाही, ऑलिव्ह ऑइल वगैरे. तर यू सर्च ऑन द इंटरनेट ऑर एनी बुक्स ऑल्सो व्हॉट इज द मेडिटेरियन टाईप ऑफ डाएट. सो दॅट इज व्हेरी इम्पॉर्टंट थिंग. तर महिलांना सांगण्याचं गोष्ट म्हणजे वुमेन आर ऑल्सो इक्वली ॲट रेस्ट ऑर रादर मोर ॲज कम्पेअर्ड टू मेन फॉर सफरिंग अ हार्ट अटॅक.
गोव्यात किती प्रमाण आहे?
मी माझी तसं स्टडी नाही, पण आम्हाला मिळतातच. महिलांना पण तेवढ्यात जास्ती करून यंग मेल्स असतात, पण महिलांचं पण प्रमाण असते बऱ्यापैकी. एस्पेशली ओल्डर फिमेल्स असतात, त्यांच्यामध्ये प्रमाण खूप जास्त आहे. वर्ष साधारण महिलेचं वय 60च्या वरती गेलं तर त्यांना रिस्क असते.
जागतिक हृदय दिनानिमित्त तुम्ही काय संदेश देऊ शकता?
म्हणजे आता जसं म्हटलं की डॉक्टर निखिल की स्वतःच्या हृदयाची काळजी तुम्हाला स्वतःलाच घ्यावं लागणार. एवढं एक लक्षात ठेव की कुठल्याही डिसीजबद्दल तू हृदयात आजार म्हणजे हार्टबद्दल असू दे की स्वतःची काळजी स्वतःलाच घ्यावं लागणार. कोणी तुम्ही एक्सपेक्ट करू नका की कोणीतरी तुमच्यासाठी येऊन करेल किंवा काय. बी ॲक्टिव्ह, म्हणजे तुम्ही जसं म्हटलं की ॲक्टिव्ह राहा, तुमच्या स्ट्रेस काढा. सगळ्यांना जसं डॉक्टर निखिल की डॉक्टर असं नाही की आम्हाला इथं बसल्यानंतर कोणा स्ट्रेस नसतो, सगळ्यांना स्ट्रेस असतो, कोणी त्याच्यापासून पळून जाऊ शकतो. पण ते काढून तुमच्या ॲक्टिव्ह राहा, तुमच्या एक्सरसाइज, डाएट, ज्या गोष्टी आपल्या हातात आहेत ते तुम्ही केल्याच पाहिजे. बाकीचे गोष्टी ज्या आपल्या हातात नाहीत त्याच्यासाठी. आणि जसं म्हणजे की तुमचा डोंट फॉर प्रिव्हेंटेटिव्ह, म्हणजे तुम्ही फ्रिक्वेंट चेकअप, तुमच्या घरात फॅमिलीमध्ये हिस्ट्री आहे, कोणाला डायबिटीजचा आजार आहे, तुम्हाला ब्लड प्रेशरचा आजार आहे, आपल्या घरात आईवडिलांना हार्ट अटॅक वगैरे, तर तुम्ही गो फॉर युअर चेकअप अर्ली. म्हणजे तुमच्या अशा लोकात जास्त शक्यता असते की त्यांना हार्टमध्ये ब्लॉकेज किंवा हे सापडण्याचे. तर हार्ट अटॅक येऊन इमर्जन्सी जसं मॅडम येण्याची वेट न करता त्याच्या आधीच त्याला वेळेत पकडून जसं असेल तर त्याच वेळेत तिथं व्यवस्थित ट्रीटमेंट घेऊन हे करून आपलं नॉर्मल लाईफ जगू. आणि आता कसं आहे ड्यू टू ॲडव्हान्स टेक्नॉलॉजी, जसं आम्ही सांगितलं की असं नाही की आधी जसं 10-15 वर्षापूर्वी बायपास झालं अँजिओप्लास्टी. आता मला एक माझं पेशंट आले होतं, त्याचं 8 वर्ष झालं मुलीचं, म्हणजे त्याला कोणतं सांगितलं की बायपास झालं की 2 वर्षात तू मरणार. असं बिलकुल नाही. दॅट वॉज द मोस्ट रॉंग. की म्हणजे माझ्या मुलीचं लग्न झालं तेवढं, पण नाव की 8 वर्षानंतर फॉलो तुम्हाला अभि तक मॅच शो किंवा मिलिटरी. तर ते म्हणजे ते एक मिसकन्सेप्शन असतं. इंटरनेट आजचं युग असं आहे, जसं मॅडम म्हणजे की खूप चांगलं आहे. जसं तुम्ही विचारत होता की असे काही ज्या गोष्टी सगळ्याच येतात त्या बरोबरच असते असं नाही. डोंट फॉलो दोज थिंग्स विच आर व्हेरी डेंजरस. डोंट टेक इन फॉर ग्रँटेड की सगळं येतं काय अद्रक खा, आलं खा, आणि ह्या गोष्टी खरंच नाही. तर ते असलं असतं तर आम्ही इथं नसलो असतो, तुम्ही इथं नसले असते. सिम्पल.
एक छोटंसं जसं डॉक्टर राकेश सर म्हणाले की मीडियावर आता इतके उपाय आणि वेगवेगळे व्हिडिओज अवेलेबल असतात. त्यामध्ये सगळ्यामध्ये काय असतं, आपल्याला काहीतरी शॉर्टकट हवा असतो प्रत्येक गोष्टीच्या सोल्युशनसाठी. तर त्यासाठी व्हिडिओचा तुम्ही बघितलं असेल पॅटर्न एक असतो की अव्हॉइड कशी करायची, बायपास सर्जरी अव्हॉइड कशी करायची, अँजिओप्लास्टी अव्हॉइड कशी करायची. ते अवॉइड करण्याची काहीच गरज नाही. आमच्यासाठी त्या रुटीन प्रोसिजर्स आहेत. वी आर ट्रेन टू डू दॅट अँड वाय वी आर प्रमोटिंग इट इज बिकॉज दीज आर सायंटिफिकली प्रूव्हन. जे आपल्याला मीडियावर अवेलेबल आहे इट इज नॉट सायंटिफिकली प्रूव्हन. त्यामुळे जे सायंटिफिकली प्रूव्हन आहे ते फॉलो करणं हे पेशंटच्या दृष्टीने आणि त्याच्या हृदयाच्या हेल्थच्या दृष्टीने महत्त्वाचं आहे. दॅट इज वॉट वी वॉन्ट टू शो.
Right. I think we've covered quite a lot of information today, and thank you so much, all the friends from media who've joined us. What we were essentially trying to do is Manipal Hospital has completed 30 years of its existence in Goa. This is our 30th year, and the evolution of cardiology department is what we are primarily trying to say, that how we have also evolved along with the modern technologies that has now come into the market, and how we have adopted that into our methodologies of treatment. So thank you for listening to all that our consultants had to say. We have the entire team of cardiology. We have Dr. Divya, who's also part of the treatment surgeons, and I think primarily everybody is trying to focus. Prevention is better than cure. That's the whole idea behind all this. And if by chance that prevention does not happen, there is a strong team available who is able to take care of the situation. With that, I think we'll close the day's press note. I hope we've been able to answer all the questions. Thank you so much. Thank you so much.